Thank you, Mr. Chairman, for holding this hearing today and to our panel for testifying. For the CDC to effectively execute its mission as a public health authority, the American people must trust that the information and the guidance coming from the agency is accurate, up to date, and based purely on the science of public health. As the directors, you must ensure that your center remains on mission and is transparent and responsive both to the American public as well as to Congress. As we examine the efforts of the CDC to rebuild their trust with the public, I want to delve into a few specific public health issues that fall within the scope of your centers. Dr. Arwudi, recent studies by the CDC and NIH found that more than 50 million Americans suffer from chronic pain, back pain, shoulder pain, musculoskeletal disorders. The HHS Pain Management Best Practices Task Force has called for individualized, multimodal care, improved access to non-opioid therapies, and increased education on pain management best practices. Dr. Arwudi, does the CDC support the task force recommendations, and did the CDC's updated opioid prescribing guidelines incorporate those recommendations?
Thank you. So the experts who work on opioid prescribing at the CDC certainly work, again, across federal government, look at the data. And in the most recent update to the clinical guidelines for opioid prescribing, there was increased attention to making sure that folks' pain is being adequately addressed, including with alternate approaches. 1 in 9 Americans is still being prescribed an opioid every year, so we have continued work to do there, but there has been and continues to need to be additional work to ensure that folks with chronic pain are getting the relief that they need at the same time.
So the task force recommendations were incorporated with your recommendations as well? Is this interaction occurring? That's my question.
So the experts who work on the clinical prescribing guidelines out from the CDC, again, are working across the federal government. I will be honest with you, this specific piece predates my start with the injury center. I can follow up on the details.
I would appreciate that follow-up. I think that we all recognize, particularly with your data, that 1 in 9 Americans are still receiving opioids annually in the United States. I think this is an important issue that we can work together on. Continuing, Dr. Arwudi, what educational tools has the CDC developed, and what are you doing to promote specifically non-opioid pain management options?
So this has been a major area of focus. We host calls that are focused on clinician education across the U.S. that routinely bring in thousands of individuals. We have developed materials and multiple pieces of guidance, as well as ensuring that when prescribers, physicians, but others as well, professional societies are meeting, they have the updated guidance, which has continued to put an emphasis on ensuring that those with chronic pain are also getting the attention that's needed. So there's been a focus on education, and the most recent updated guidelines from 2022 reflect more of that.
And I appreciate that focus on education. Dr. Hacker, according to the CDC, approximately 2 million Americans have type 1 diabetes, which requires lifelong insulin. A simple blood test can detect the disease in its earliest stages. However, in those early stages, before insulin is required, those who test positive for associated autoantibodies can be monitored to help prevent diabetic ketoacidosis and be referred to medical interventions early to delay that onset. I recently introduced H.R. 8698, the Screen for Type 1 Diabetes Act, with my colleague, Dr. Kim Schreier. This bill would create a public awareness campaign through the CDC on the benefits of early detection. Dr. Hacker, how would this bill enhance the CDC's efforts to provide comprehensive information and support for early detection and management, especially for clinicians?
I don't know if that's on. So while I cannot comment on pending legislation, I will say that I think the strategies around type 1 diabetes and early intervention really speaks to our center's focus, not only on preventing disease, but also on helping early intervention, because, as you said, diabetes type 1 is not known to be preventable at this point, but obviously strong management with insulin and regularly monitored insulin levels can be extremely helpful in terms of preventing future problems.
And
with
those future
diabetes.
problems, which you elicited earlier and talked about, the renal effects, the kidney effects, the ophthalmologic effect, the effect on the eye and early blindness, that is what this piece of legislation is working to do, to develop an ability to recognize type 1 diabetes early and to prevent those terrible sequelae that so many type 1 diabetics have to deal with. This is a piece of legislation, a bipartisan piece of legislation that I think would answer some of the questions that you have raised to us. Mr. Chairman, my time has expired. I thank all of our witnesses for being present with us here today, and I yield back.
Gentleman yields back.